So, hello viewers. Here we have with us Dr. Manisha. This is the another session face to face with toppers. I am happy that she made it to an institute of national importance, that is Sri Chitra.
Good evening, sir. Hi, everybody. My name is Manisha. I studied both my MBBS and MD in Andhra Pradesh, Kurnool Medical College. I completed my exams this year. It's this theory and practical exams this year. So I've been preparing for neurology since 2 months.
So, you are a role model for all those who are freshers and trying to give the attempt in the first go. So, tell me about your preparation.
Sir, actually, I wanted to become a neurologist from my MD. So once I started MD General Medicine, and even during MBBS, I was very interested in neuroscience. Sir. Neuroscience held a lot of interest for me, even while dealing with fundamental subjects. But once I started dealing with patients, I felt more comfortable and more empathetic when I was dealing with neurological patients with neuro disorders rather than any other. So I wanted to be a neurologist. I decided to be a neurologist when I was in first year of MD General Medicine. Sir. So once I decided, I specifically studied neurology subjects with more interest, as it held more interest to me. The core subject and core preparation for my DM entrance, I started after my exams, theory examinations. Most likely, I started at September last week. I started my serious preparations. Once I wrote my NEET exam and I got the results, I started serious preparation from then, sir.
So, you mean to say that you started your preparations very early during your MD first year, but the actual this intensification of your preparation started just I think 25 days before the NEET. That's what you're saying.
No, sir. I started preparation actually after NEET. So I didn't prepare anything for NEET SS exams, sir, because my exams were over just 1 week prior to that. After examinations, I didn't even know how to prepare for SS, sir. I just gave an attempt to know where I stand, sir, in SS examination. I started preparing after my NEET SS examinations, sir.
So during your MD preparations, did you have that kind of entrance kind of attitude of solving questions, or was it gaining the concepts and studying for the PG as such, or like reading with the cases?
I was not MCQ oriented during that time, sir, not like question oriented, sir. I actually used to study Bradley even for my practical preparation during MD, sir, for my case presentations and everything. Along with my Harrison preparation, I used to read Bradley Neurology also at that time, sir. Mostly concept oriented preparation, sir. I didn't give any MCQ orientation during my MD, sir, but I completed most of the subject thoroughly during MD days, sir. As far as neurology is concerned, compared to other things, I completed neurology a little bit more, sir. Sir, like in MD period, we used to present cases, sir. Like the case which I am going to present, that case related thing, that chapter I used in Bradley, sir. Like for example, if my case was posterior circulation stroke, I read the entire stroke chapter in Bradley, sir. And if the case was motor neuron disease, in that way I read MND topics, sir. If myopathies we presented once, so I read not like Harrison, sir, but I just read only some few topics in Bradley, sir, because I couldn't complete entire Bradley, sir. It was big even then. The case which I am going to present, sir, related to that case and the DDs, those topics I read, sir. Mostly I completed stroke and motor neuron disease, neuromuscular junction disorders. I did not read specifically during that time, sir. Later I completed during that time myopathy and peripheral neuropathy. The case which I am going to present, like specifically CIDP, the important topics, sir. Those I completed in Bradley.
Bradley
Because,
usually not much of us during our MD period follow Bradley. But as you said, with the case, if you study Bradley, I think it gets retained more, especially the concepts, core concepts in neurology are there in Bradley and will be retained more. So I think, according to you, the important topics would be based on the cases you get. So I think that is a very good new information that the freshers or the people who are now in PG should follow from you. So at that time, as you said, you didn't you studied the one of the two of the big textbooks, that is Harrison and Bradley. Apart from
yes,
that,
sir.
you didn't have any MCQ oriented textbooks like Ajay Mathur sir or some other books.
During MD, I did not follow any MCQ books, sir. No, sir. I didn't have actually time, sir. In our college, it was very hectic, sir, residency. So after residency, there were frequent case presentations and everything, sir. So more focus was actually on practicals, sir, on my this rather than just studying, sir. Everything was more on practical approach for the patient. So I used to study more Dijang and Bradley, sir. I didn't actually have time for MCQs, sir.
So after writing
Yes.
the NEET, what did you actually feel?
After writing NEET, I found that there was a lot of Harrison-based questions. I felt that if I could have read it, at least if I would have revised the entire Harrison-based neurology during that some 15 days, the time I got, I could have maybe got a better rank. So rather than 236, I could have maybe within 100 or 50. So because there were a lot of questions, both general and neuro portions. There were a lot of questions from Harrison as far as NEET SS is concerned, sir. Um, we do read. I did read during my MD, but not MCQ oriented, sir. So as a result, I could not make correct options for many questions, sir. But Harrison neurology and Harrison for even general subjects is a must, sir, for NEET SS. I think if we read thoroughly Harrison, sir, for neurology and SS, for neurology and general subjects, as far as NEET SS is concerned, we could crack with a very good rank. So that's what I felt after my exam, sir.
Did you feel that if you had solved the MCQ books or got an MCQ kind of attitude of reading Bradley and Harrison, it would have helped more? What do you think?
Yes, sir. It would definitely have helped, sir, because once we go to MCQ mode, we try to rule out, or we try to even think what questions could be asked, sir. And it would be better to rule out options when they are given, sir. But if you don't read in an MCQ mode, it'll be difficult to crack entrance examination, sir. We need to get a core concept, but still MCQ oriented approach is necessary, sir. Maybe at least 1 month should be focused on MCQ orientation, whether this question, how can this question be asked. We should definitely have an MCQ. If I would have attempted some mock tests, or I would have read some MCQ oriented books even during my MD, maybe I could have cracked SS itself, sir, with a better rank.
So I guess along with your Harrison, in your MD itself, you need to get acquainted with some MCQ books, or
Yes.
occasional solving of mock exams would definitely help you in your long run.
Yes.
Especially
Yes.
while sprinting in the last few months for the exam. So NEET, I think you were disappointed with your rank. What made you try for the institute exams which were upcoming?
Actually, I wanted to do DM in an institute, sir. I decided that while I was doing my MD, sir. So my primary aim was always institute exams, sir. If I get at least below 50 in NEET SS, and if I get a very good institute, I wanted to take in NEET, sir. But I got some 236. The thing that motivated me was, okay, I got at least a seat getting ranked. Maybe that thought was there in my brain, sir. But still, I thought that maybe if I could have prepared, I would have gained a more better rank. So with that thought, the thing that comforted me was I didn't have preparation and there was very less time, sir. So I was not dejected, sir. If I would have prepared and there was a little lot of time and still I couldn't crack the exam, I would have maybe.
Did you do anything extra apart from NEET other than intensification of your studying process? Did you start, now you know that mock exams and other exams need to be solved. So did you do anything extra for the Chitra theory?
Compared to other NEET SS exams, sir, in Chitra theory, there were questions also from Bradley, sir. As far as past question papers were concerned, there were not purely Harrison Neuro, sir. There were also Bradley questions, and there was more focus on basics, sir, like neurophysiology. There were also questions from basic subjects. So for Chitra, I read Harrison Neurology, and Bradley, whatever I read, I revised, sir, the neuro portion. Along with that, I read physiology, sir. In Genong, I read, sir, neuro portion. And Pharmac, I tried to read, sir, but I didn't have a lot of time. Pathology. So for Chitra, I think there should be more focus on basics. Along with, I got time around 1.5 months for Chitra, sir. I started Chitra preparation from October 1st, sir. Exam was in November midweek, sir. So first 1 month, I focused on this Harrison portion, sir, of Harrison and Bradley, and the remaining 10 to 15 days, I read physiology portions, physiology, and I revised what all I questions. I did almost all your mock tests, sir, from starting and ending. Apart from that, I did MCQs for medical professionals by Aditya Udapa, sir.
Yeah.
There was a book, that book I did, sir.
So in our mock exams, what were your ranks? I don't remember exactly. Were you able to crack in the top, or?
Initially, I was a little bit backwards, sir. Like in the first test, I was around some 15, 20, sir. But nearing the examinations, I was above like in top 10, I used to crack, sir. For Chitra mock, that one you conducted before Chitra, I got first, sir. And for a few exams, I got in first 5, but mostly below top 10, sir. But Chitra and one more exam, I think I got in first.
So you tried other than Chitra, my enhanced mocks, AIMS mocks, etc. Yeah. Everything. That all helps.
Yes, sir. I tried almost all your tests, sir. They helped, sir, because the questions, some of the questions in AIMS examination, while attempting AIMS examination also, I found many of the questions from mock, sir. Like in some of the newer drug in SMA, there were many questions that were given from your test, sir. And the questions were from similar topics, if not direct. And it also helped me to focus on which topics I'm missing out on, and the approach, sir, how to approach my questions, and I will know where I stand compared to my other the students who are preparing. They helped actually a lot, sir, not only for Chitra, for other exams. The one I wrote in AIMS also I got many questions.
So what
Yes,
is
sir.
the selection process difference did you find in both? Actually, AIMS also has an interview. Chitra
Yes, sir.
also an interview. So which was
Yes,
more
sir.
tougher for you? And means
Um,
while attempting, what difference did you see?
For me, Chitra was tougher, sir. The interview, actually, after Chitra theory examination, they don't even give any rank list, sir, who got top or not. So we don't know. It will be a confused state, sir. So I thought, let me prepare and see until last. There were two steps initially, sir. For the first step, even the first interview, it was an intra-departmental interview, sir. There were like five professors, sir. Five professors. They were asking me each scenario and DDs for each scenario, sir. It was around 25 minutes to 30 minutes, sir, my interview. So during the 25 minutes, there were around 4 to 5 questions, and each question they asked further viva, sir. It was a pure viva session, like, sir. And they went in depth also, sir. Some few questions, some were basic, and some were few questions were in depth. They also asked what's your approach? How do you treat the patient? Based on the way we are answering, they are going into. It was like a practical. The thing we present in our wards, it was like a practical viva, sir. The Chitra, and because the first step was around 20 to 25 minutes. And the questions were few were simple and few were complicated, sir. But compared to but in AIMS, it was not like this. It was only some 5 to 10 minutes, sir. AIMS session interview was 10 minutes. There was only a single case scenario, sir. They have given me a neuroradiology image, and they have kept some 4 to 5 questions, sir. That was the only thing, and it was 10 minutes. The questions were of similar standard in both the exams, sir. However, there were more questions, and it was of more duration, and so I felt Chitra was more tougher, sir. And there was also another step in Chitra, sir. This interview was okay, sir, but the second interview, it was interdepartmental interview, sir. For me, neuroanesthetist, sir, and a neurosurgeon, sir, asked few questions, sir. I think they were very tough, sir. What was compared to interdepartment questions were a little bit tough for me, sir. And so as far as interviews are concerned, Chitra was tougher compared to AIMS, sir. Because of the number of steps and the duration of the interview, and the questions also were many, sir. There was only one scenario, there some 4 questions, sir. Here there were like 4 scenarios, and in each scenario there was some subset of the, based on the speed and the way we answered, there were many questions, sir. And interdepartmental was very tough for me, sir, compared to intradepartmental, sir.
So can you just tell a few, not all questions, just a few of them? Like AIMS, what just one question was asked. Do you remember what was asked? For the benefit next AIMS aspirants.
AIMS, my question was, they have given me a CT image, sir. That CT image consisted of dilated ventricles. That it was it resembled a meningitis. So what was I thinking, sir? They did not say whether it is correct answer or not. They just, what is the diagnosis? What the questions were? What is the diagnosis? Just read the CT first. What is the diagnosis? And what are your DDs in this? So how do you approach the patient after CT? What is the next investigation you go for? How do you treat the patient? And I diagnosed, when my DDs, my first was the tubercular meningitis. Considering ours is a tropical country, I actually supported my diagnosis, sir. But until then, I didn't know whether it was correct or not. They did not show any expression. They just heard all my answers and said, okay, interview completed. That's it, sir. So the basic, this thing was, there was hydrocephalus in my CT, sir. Okay. But the questions, and based on, there was a scenario, sir. One paragraph, the patient duration, it was a subacute presentation, sir. Altered sensorium fever. What as far as I'm concerned, I think it was a tubercular meningitis question, sir. Based on that, they went in depth, sir. How do you treat? What are the ones in resistant cases? What do you do? Those were all the questions, sir.
TB questions were asked since you commented TB meningitis.
Because I committed to that diagnosis, questions were in that direction, sir.
What were your practical marks? Because theories, they add on both marks and come to a rank.
Yes, sir. For practical, out of 20, sir, I got 18 marks, sir.
Oh, that's actually so that your answer was correct. So CT, what
Yes.
you have said is correct. That's why you got the top
Yes,
mark in practical. So I think you
yes, sir.
just came a bit below in the theory marks. So
Oh,
theory
yes, sir.
marks
I
mattered
got very less. Yes, sir.
for you. Theory marks mattered. What was your aims rank?
I didn't know whether there was any rank, sir. I just saw waiting list rank seventh, sir. In waiting list, there was seventh, sir, for Delhi. And I opted only for Delhi, sir. I didn't, because there was a preference list prior, sir. They asked for which institutes. I didn't opt Jodhpur, Orissa, nothing, sir. Only AIMS Delhi I have kept, sir. In AIMS, Delhi rank list was given as some seventh waiting list person, sir.
Can we just have one
Yes.
or two questions from Sri Chitra interview, just to for the Sri Chitra aspirants?
In Sri Chitra, in the interview, there was no image or PPT, sir. So, sir or madams, they asked orally, sir. They gave me a scenario like the patient came he's, with a sudden onset weakness, acute duration. Uh, so, what is the initial approach? What do you think? What is the etiology? That was one pattern, sir. Ma'am gave just a scenario, sir, like sudden onset limb weakness. What is the first thing you do? Preliminary steps for the patient and how do you diagnose? What is the DDs? Once I said my DD has first possibility as acute vascular etiology. Then she further asked me what are the scores needed to assess the patient preliminarily and once you admit in the hospital. That were the questions. And after that, how do you treat the patient and what is the acute management? How do you differentiate what is the type of the stroke in the patient? And what is the first investigation you do? And without CT, how do you differentiate whether it is ischemic or hemorrhagic? And if it is ischemic, what are the steps you follow? If it is hemorrhagic, what are the steps you follow? And what are all the things if the patients, if the in my scenario, ma'am gave the age as some old age, 60s. What is the scenario if it is young? What is your first possibility if it is young in as far as etiology is concerned, sir? And they asked me how do I manage a hemorrhagic stroke patient, sir? All the things, the steps prior to surgery and when do you do everything, sir. That was the one scenario, sir. Then the other scenario was about a diabetic patient. If he had sudden onset blurred vision, what are all the possibilities you think female? That was one scenario, sir. So based on the way I answered, they asked me questions, sir. If I was able to say correctly the diagnosis, they went to treatment and everything. If I was not able to say the diagnosis, they asked other DDs and they just stopped there, sir. And other scenarios, one was about encephalitis, sir, scenario, acute onset altered sensorium fever, DDs, and they asked all modes of treatments there, sir. Then other thing was about status epilepticus. One question was there, sir, that related to encephalitis itself, sir, herpes encephalitis status presentation. So these were my scenarios, sir, a few scenarios. Similar questions, there were some 5 questions, 5 scenarios. Each professor asked this question and they ask in detail then sub questions, sir. And some of the questions professors asked for a long time, sir. They focused the way by the way of I was answering, they went until treatment and after treatment and everything they went, sir, follow up. For a few questions they stopped with just the diagnosis.
How did you spend the time preparing for Sri
I
Chitra?
actually I didn't prepare for practicals until after my theory results, sir. So I was MCQ approach was there until my results. Sir, after results, there were some 5 days, I think, sir, between theory and practicals. During that 5 days, I revised. I used to prepare from my practicals. In a separate notebooks, I read whatever I read in my neurology practical notebooks, sir. Just my practicals were completed in September, so I revised everything I read. And apart from that, I read the recent things, sir, like AHA guidelines, recent
Yeah,
guidelines for stroke.
2015
Yes, sir.
guideline.
And yes, sir. And recent guidelines for status epilepticus, I read those things, sir. What are all the emergencies I read, sir? And things, sir. And along with that, we formed a group for practicals, sir. There in that group, sir, and you used to put some case scenarios, sir. If I was not able to answer any of them, that I used to read a bit in depth, sir, like some images and at first we thought there will be neuroradiology questions, sir. So I also read a little bit about MRI sequences and neuroradiology.
Okay.
That's it, sir. That's all I prepared. That's all I could prepare in 5 days, sir.
So in the 5 days, did that group was formed by me, and I had invited Dr. Krishnamurthy sir, who is the head
Yes,
of the
sir.
department of Davangere Medical College. Did that benefit in your?
It actually helps, sir, because even in group, you always advise to come forward and post, definitely answer something. And once we answer, it wasn't like just an answer. You used to also discuss about details of the answers we placed, and we also pasted some videos. Even though the approach helped me actually to come into practical mode, sir. Just I was in MCQ mode until then, sir. It actually helped me to think and to prepare for practical approach, and actually it helped a lot in interviews, sir. I could discuss a lot. Even the exact questions were not asked, still the approach I learned in the group, sir. And some questions, sir also told what all could be asked. That things helped a lot, sir.
Whether they shouldn't do, especially if they are freshers and suddenly immediately after your studies going for the exam. So next year, what would you suggest? Anything specific?
Sir, I would, along with, apart from all this, I would suggest to solve as many mocks as possible, sir. Mock tests, sir, because without tests, I was not able to even understand what I was doing, sir. Mocks give a direction, sir. Even if our preparation, because mine was only like 1.5 months to 2 months preparation, sir. I couldn't fit entire Bradley into my preparation. Mocks give the areas which we focus on, sir. It actually gives direction, especially if the time is very short and we are unable to complete or know everything that is supposed to be read. If you are unable to complete, mocks actually give a lot of directions. So for me, that Bradley Harrison, I completed everything in MD, sir. It was more like revision for me that 1 month. I did a lot of mocks during this period, sir. That is one thing. So should do as many as tests as possible, sir. And what we should not do, that is Harrison should be completed, sir. Even if Bradley is important, Harrison, we should never leave it, sir. Sometimes we think neurology specific, so Bradley should be the thing, but that's not the issue, sir. Even in Chitra also, there were Harrison, especially for general medicine, sir. There are around 40% were general medicine questions. For that, definitely Harrison helps, sir. Harrison is first. We should never neglect Harrison, sir. After that, Bradley, some portions, even if we are not able to complete Bradley, we could maybe crack some entrances, but without Harrison, we cannot crack the entrance examinations. So Harrison is must. And the next thing is should solve as many as mocks, as far as I am concerned. So those are the two things I followed, sir.
And regarding the new kid in the block, that is pediatrics, it's gaining so much of importance.
Yes, I completely forgot about that. In NEET SS, it was like a pediatric neurology exam, sir. It was not a medicine exam, sir. I was completely shocked because there were so many questions in pediatric neurology, sir. That should be definitely be focused, sir. I actually forgot about it because there were not many questions in pediatric neurology in Chitra, sir. However, in SS and AIMS, there were there, sir. We should definitely complete, sir. I don't know whether I didn't read Nelson's, sir, actually. So I think for next NEET SS, neurology aspirants should also read Nelson's neurology portion, I think, sir, because there were a lot of questions. Around some 30 to 40% were from pediatric neurology, sir. That should be focused.
So according to you, for pediatrics, the medicine guys should also read Nelson, but that is a big
yes,
anyway, you have to find some way to crack into Nelson and get
like some topics, sir. They focus only on certain specific topics like neurodevelopmental disorders, neurocutaneous syndromes. I think those things can be covered, sir. We can't complete all Nelson, sir. I agree. We can't complete all Bradley also, sir. Completing Harrison is difficult. Specific portions, sir, whatever have been repeated in prior tests, that should be completed, I think, sir. But this next NEET SS, I think definitely pediatric neurology should be completed, sir, because there were a lot of questions in SS, sir.
Tell me.
And for institutes like AIMS and Chitra, practical approach is a must, sir. It's not just MCQ. We should focus simultaneously with MCQs, at least if we want to crack institute examinations. Specifically AIMS and Chitra, we have to keep at least some 2 to 3 hours per day, especially for practical approach itself, sir, because they also study the approach, the way we are questioning, sir. I think we'll forget everything after practical, sir. That approach should be brought back. We should be able to keep in touch so that we don't forget the approach, sir. Because in Chitra, I think 50% marks they will give for practicals. I don't know exact the percent, sir, but percentage is also high for Chitra, I think, sir, for practicals rather than just theory.
To all the viewers who are preparing for 2021 NEET exams as well as the institute exams, you can take cues from Dr. Manisha. Because those who are, especially those who are preparing, they're studying their PG right now. they shouldn't feel that okay, you need 1 year to crack into these institutes, etc. And don't think that this institute exams are out of my league. I am made for NEET. I may not be able to crack this high institute exams like Chitra and names. If you now itself, if you start studying, as she said, Harrison, and now she has included Bradley. That's a very good point. To be honest, I never studied Bradley in my MD days, but I covered my Harrison well. So Bradley definitely should be added because the competition is becoming very much these days. So you shouldn't be left behind, and you should add on Bradley if possible. Don't think that it's tough; it's possible. Just as she said, focused reading of Bradley along with Harrison will definitely make a difference in your life. And you shouldn't start anything later. You shouldn't keep for end. I think ideally, at least by the second year, you start studying. Even the first year
Yes.
people who are viewing this should start studying, or tell your colleagues if final year or second year are seeing this, start your first years to start studying. Hold the standard of your institution, your discussions all will change once you come into this entrance mode of reading Harrison and Brad. That is another aspect. So I think with that, I will end this session. I congratulate Manisha deep from my heart. That's a very good achievement. And I am really happy that she made it. And all the listeners also and viewers also, all the best for your next exam.